Hi, everyone, and welcome to another episode of the STEMS Monthly Minute. Each month, we share a short update focused on practical topics that support patient care and strengthen our EMS system across Allegheny, Cattaraugus, and Chautauqua counties. Today, we're talking about hospital pre-notification and why it is much more than simply letting the emergency department know you're on the way. Why pre-notification matters. When EMS contacts a hospital before arrival, the goal is not simply to announce that an ambulance is coming. The goal is to give the receiving facility the information they need to prepare for your patient before you arrive. Those few minutes of preparation can make a significant difference in patient care. A good pre-notification allows the emergency department to anticipate the patient's needs, assemble appropriate resources, prepare equipment, and coordinate staff before the patient reaches the door. In many cases, the work that happens because of your call begins before your patient ever arrives at the hospital. What information does the hospital need? A good pre-notification should answer 5 basic questions. Who is the patient? What is happening? How sick are they? What have you done? And when will you arrive? In most cases, hospitals need patient age and sex, chief complaint or mechanism of injury, significant findings, important vital signs, treatments provided, and estimated time of arrival. The goal is not to provide a complete PCR narrative. The goal is to provide the most important information that helps the receiving team prepare. Let's look at a few examples. For a suspected stroke patient, a good pre-notification might sound like this. 68-year-old male with sudden onset right-sided weakness and slurred speech, last known well approximately 30 minutes ago, blood glucose 112, blood pressure 184/96, stroke alert criteria met, ETA 8 minutes. This information allows the emergency department to prepare for rapid assessment and imaging before the patient arrives. Including details such as last known well time and blood glucose can be extremely important for treatment decisions. For a patient experiencing a possible STEMI, a pre-notification might include 54-year-old male with chest pain and STEMI criteria identified on 12-lead ECG, aspirin administered, blood pressure 100/56, ETA 12 minutes. This allows the hospital to begin coordinating resources and preparing for the patient's arrival. The earlier the hospital understands what is coming, the sooner they can prepare. For trauma patients, hospitals need a clear picture of mechanism of injury and the patient's condition. For example, 22-year-old female involved in a rollover motor vehicle crash, significant intrusion into the passenger compartment, suspected left femur fracture, blood pressure 92/60, ETA 10 minutes. This information helps the receiving team prepare staff, equipment, and treatment areas before arrival. There are several other patients who may benefit from pre-notification. This is not limited to stroke, STEMI, or trauma patients. Other patients who may benefit include patients in severe respiratory distress, sepsis patients, cardiac arrest patients with return of spontaneous circulation, critically ill pediatric patients, and obstetrical emergencies. For example, notifying the hospital that you are transporting a patient in active labor or a patient with severe hypertension during pregnancy allows the appropriate personnel and equipment to be prepared before arrival. The key is recognizing situations where early preparation can improve patient care. Common pitfalls. A few common challenges with pre-notification include calling too early before enough information has been gathered, calling too late when the hospital has little time to prepare, providing too much information and burying the important details, forgetting to provide an estimated time of arrival, or failing to update the hospital if the patient's condition changes significantly during transport. The most effective pre-notifications are concise, focused, and clinically relevant. When making a hospital pre-notification, remember, be concise, focus on the important information, include significant findings and treatments, always provide an ETA, and consider what resources the hospital may need to prepare. Your goal is to help the receiving team understand what is coming and what they need to be ready for when the patient arrives. Hospital pre-notification is more than a courtesy call. It is an important part of the patient care and system coordination. A brief, focused notification gives the hospitals opportunity to prepare the right people, equipment, and resources before your patient arrives. Whether the patient is experiencing a stroke, cardiac emergency, traumatic injury, respiratory distress, obstetrical emergency, or another critical illness, those few minutes of preparation can have a meaningful impact on the patient's care. Thank you for everything you do to serve your communities. If there are any topics you'd like us to cover in future monthly minutes, please reach out. STEMS is always here to support you.